Can gut health improve frequent bladder urination? Imagine your gut and bladder are part of a complex team working together to keep your body balanced. Recent research suggests that the health of your gut microbiome might influence how often you feel the need to urinate. While this is an exciting area of ongoing study, it is important to remember that gut health is not yet a proven treatment for bladder conditions like frequent urination or overactive bladder. Scientists have found that people with overactive bladder often have different gut bacteria compared to those without symptoms. Certain bacteria, such as those in the group called Firmicutes, seem to be linked to bladder symptoms. These bacteria can affect how your bladder muscles contract and how nerves signal your need to go, through metabolic and inflammatory pathways. This idea points to a possible gut-bladder axis, where the health of your gut could influence bladder function. Research also shows that the community of microbes living in the bladder itself, called the urinary microbiome, varies in people with overactive bladder. Some beneficial bacteria like Lactobacillus tend to decrease, while potentially harmful bacteria like Proteus may increase in those with bladder symptoms. This imbalance might contribute to feelings of urgency and frequent urination. There is growing interest in whether modifying the gut microbiome could help manage bladder symptoms. For example, probiotics containing Lactobacillus strains have been shown to reduce urinary tract infections, which can worsen bladder issues. Some clinical trials are exploring whether probiotics can improve how patients respond to medications for overactive bladder. Since recurrent urinary tract infections are a common cause of frequent urination, maintaining good gut health might help reduce the risk of these infections. Restoring healthy gut bacteria through methods like fecal microbiota transplantation has been reported in some cases to lower the chances of recurring infections, though this approach is still experimental and not approved specifically for bladder health. Obesity and inflammation, both linked to gut bacteria, are also associated with overactive bladder. Inflammatory substances and nerve growth factors influenced by gut bacteria may alter bladder muscle activity and nerve signaling, leading to symptoms like urgency and frequent urination. However, it is crucial to understand that improving gut health is not currently a primary or standard treatment for bladder conditions. The main approaches for managing frequent urination and overactive bladder include behavioral therapies like bladder training, fluid management, pelvic floor exercises, medications, and, in some cases, nerve stimulation or surgery. While research into the gut microbiome offers promising insights, it remains an emerging field. There is no solid evidence yet that changing your gut bacteria directly improves bladder symptoms or prevents bladder cancer. Maintaining overall bladder health involves following medical advice, managing risk factors, and seeking care from healthcare professionals. In summary, your gut health might play a role in bladder function through complex interactions involving bacteria, inflammation, and nerve signaling. But for now, the best way to address frequent urination is through proven medical treatments and lifestyle changes. Always consult with a healthcare provider to develop a personalized plan that suits your needs and ensures safe, evidence-based care.